rolling, and we are good to go.
Okay. What's your weakness? I don't know how to say no. I pretty much say yes to everything. What kind of music do you listen to? I listen to anything except country. Not a big fan of rap. A little bit is okay, but definitely not country. What are your areas of interest? Well, I take care of women who have breast cancer or are at high risk for breast cancer, but I also take care of breastfeeding moms, and it's so much fun to see those little babies. But women's health, that's my area of interest. What advice would you give to your 16-year-old self? It's really going to turn out okay, even though you may not be doing all the things you're supposed to be doing. It's all going to be fine. And you'll figure it out 30 years from now. What's your favorite movie? Well, I really liked this movie called There's Something About Mary. That was my favorite for about 20 years, but it was too long to type in for my epic answer, so I had to change it to La La Land. What's your favorite quote? I have two. Well-behaved women rarely make history. That's one. And the other one, and I think Ruth Bader Ginsburg said that, and then Michelle Obama said, when they go low, we go high. What do you do on a regular Friday night? Honestly, I fall asleep in front of the television. What questions do you hate to answer? Well, I'm not a big fan of answering any questions, but it's always hard to answer questions when my patient says, well, what would you do if it were you? That's really hard. If you could retire tomorrow, what would you do? I would put my feet up, watch movies, travel, and go to Broadway shows. What is the one unhealthy thing that you do? I really like chocolate. Really, really like chocolate. What piece of advice do you give your patients most often? I usually tell women to not be so difficult. No, I'm just kidding. Let's undo that. Let's undo that. I usually tell women not to be so hard on themselves. People are their own worst enemy, usually, and high expectations. And so you're going to be disappointed a lot. Just go easier on yourself. Where do you see yourself in the next 10 years? Probably sitting in this chair, talking to you guys. I think I will still be doing what I'm doing now, if all goes well. What was your first thought when you woke up this morning? I thought, why do I have to wake up right now? Can I go back to sleep? I also thought about this interview and what I was going to wear. Okay, where did you grow up? I grew up in Waukegan, Illinois, which is about an hour or so north of Chicago, right on Lake Michigan, and moved when I was 18 and unfortunately have never been back. Do you have any hidden talents? I play piano and I sing, but I'm not going to demonstrate for you. Where is your happy place? I try and make every place my happy place. I don't have a special go-to, but it's all about just taking a break, just being in the moment where you are, you know, trying to catch up to what just happened to you and start fresh. What has been your proudest moment? So I don't think it's a moment. I think it's the part of my life that I'm proudest about, which is watching my children grow up and become these amazing people. Amazing. What's an interesting fact we don't know about you? I'm tall.
Excellent. Good point.